Welcome back to Vegas Live with Ninon. I'm Ninon to Pureza. Yes, I'm giving you my full name so you just remember who I am, in case you forgot. But just call me Ninon, it's fine. Is there a doctor in the house? Yes, there is a doctor in the house. There's actually 3 doctors in the house, and this is my number 3, Dr. Shiven. And Dr. Shiven, you are part of this group.
Yes.
Now, let's get the name of this group you have. What name do you go under for?
It just goes by Dr. Shiven Integrative Medicine Group.
Oh, so you're the head honcho.
Yes.
Aha! Got the number 1 now. I knew we were getting to the number 1. And what do you practice in? I found out what one is peace of mind and one is self, and they've all got different ways and different things. And what do you do?
So I'm an internist by training. So I did something called internal medicine. And then once I was done with my conventional MD, I went and got more training in something called integrative medicine.
Integrative medicine. So you actually deal with medicine.
Absolutely.
So how about COVID-19? What are we doing with that?
That's a
terrible question. Ninon is back again.
Actually, so I've been on the front lines for the past couple of years since the pandemic started.
I'm quite sure you have.
And so I actually teach medical residents learning to be physicians in the hospital. So definitely.
So you've been totally involved in this whole thing.
Absolutely.
Anything new that we should know?
This is what I believe, and after treating, I think, over 1,000 COVID patients now, there are no good effective treatments. We know that already.
Yes.
And of course we're working on some, but the bottom line is to get yourself healthy and better. And I think with
I love that. Yeah. Why don't we all just think about ourselves and take care of ourselves and get ourselves better? And I mean, vaccines take 5 to 10 years actually to produce and to get together. If people don't know that, is that correct?
Yeah, and
longer or shorter, but
absolutely. There's amount of time that vaccine needs to be effective, but also there are variants. Yeah. So as you know, with Omicron, we don't even know if the vaccines are going to be effective. So the best thing to do...
Oh, this is lovely to know all this knowledge. Oh, sorry, guys out there. If you all thought it worked or didn't work, it's now the horse's mouth, right? The doctor.
Well, I certainly think there's effectiveness in vaccines, and not to, belittle that.
Of course there are.
Absolutely. But I do think...
Not necessarily all these that are going around.
Absolutely, exactly. And so what can we do really to take care of ourselves is to just live a healthier life. So a lot of things that we have learned from other types of medicines, whether it's Ayurveda or traditional Chinese medicine, we talk about nutrition, physical movement, herbs, botanical. It's the complementary medicine, and I think that really could be very effective against...
Are we getting down to sort of the natural medicine, and because there's too many things put into pills now that if you take this you're going to die of a heart disease, but you'll be over what you have over here, and over here you might get this because your liver might not like the medicine I'm putting into you.
Absolutely, there's so many side effects of our modern pharmaceuticals.
Well, we cure one thing and then get 10 other things wrong with us.
Right, I know. And even as something like a Tylenol that's considered so benign can have effects on the liver. So as you could imagine, there are issues with even these drugs that we're just kind of selling like candy. So I think it's something that definitely we need to revisit, and as physicians we have that responsibility.
Now, we always liked, or whenever we hear anything about a Chinese medicine, we all get very, very excited, and we all get, that will cure us. Are we? This is a very bad question. Are we still thinking of it that way?
This is what I think. I think traditional Chinese medicine has a lot of things that is knowledge from our ancestors for thousands and thousands of years.
Marijuana happens to be one of them.
Absolutely, and actually, CBD has so many, and CBD and THC actually, they have so many medical benefits that certainly we've used it in our patient population, and people have gotten better. I
have actually used it because I had a very, very bad hip problem, and several years ago, but I only used it for, I don't think there's a definite time for you to use it, but I think I used it for 2 months. Not only did it cure my hip, I had a very, very bad hip, but it cured a lot of other things that I had that were kind of there, and they've all kind of vanished. So CBD, I'm 100% for CBD, by the way.
Right, absolutely. It can help with stress.
But that was an old Chinese thing.
Yeah, I mean, there are so many herbs, even in Chinese medicine, that are so effective, and I've seen it. We've just in some of our patient population.
And yet we're still on about China with the COVID, COVID-19. Did you give it to us or didn't you give it to us? Or
Right.
where did it come from? We're still like, you know, the political side of it.
I think we're bickering a lot because it's become this political issue.
Has it become a political issue, you think?
Absolutely, absolutely. I think, you know,
There you
even,
go. I didn't say it. You're a doctor. And that's what you see.
Absolutely. I cannot agree more.
Now, with how long have you had your what do you call it?
Integrative practice, or
Integrative, whatever. What do you exactly call your practice?
it's integrative medicine.
Integrative medicine.
And it's a combination of Western medicine as well as alternative and complementary medicine.
Because everyone knows what alternative medicine means, pills, right?
Well, we sure can work with that. You know, pills are useful, and
Yes.
there's a time and a place, though.
Okay, all right. And how long have you had this practice?
So we've actually started about 6 months ago now.
Oh
and,
wow, you're new.
Yes, yes.
I love it. I love it. I love it.
And just to tell you about the team, we have of course, I'm the MD. We
Yes.
have a clinical psychologist. We
Yes.
have a wellness coach. We have a
Yes.
traditional Chinese medicine practitioner.
Really?
And so all together, we've come up, you know, one of the complications that we've seen in integrative medicine is that your naturopath is not talking to the MD, right? The clinical psychologist is not talking to the MD, or the dietitian's not talking to the
No,
clinical
you're all
psychologist.
talking together though.
We're talking together. And so we also have a dietitian, I forgot to mention that.
Okay, so you all have, so you can all, do you have meetings of all of you, which are, you're all, they're all doing different,
Yes.
you've all got different aspects of what you're doing.
Exactly. Mhm.
So do you bring that to the table?
Absolutely. So what we tell patients when they sign up with us, that we're going to have a multidisciplinary discussion about their, you know, problems and ailments.
Yes.
And we're going to come up with a plan where we're all involved. Because, you know, if let's say you have somebody that is struggling with weight issues, but, you know, as a kid they've had an eating disorder.
Keep your
Right.
mouth shut and stop. Don't ever go shopping when you are hungry.
That's good advice. That's
Don't
very good
ever
advice.
go shopping. And don't think I haven't done it. I do it all the time. I go to a store, because normally it's kind of the end of, you've done all your little bits and pieces, and you go into the store. I'll go into the market before I go home. By this time you're starving. And you kind of buy everything, and then when you get it into the car, you're going, what can I nibble on?
Oh my God. I am so glad that you actually brought it up, because in our practice, we do something called mindful eating. So which means exactly that. You're listening to your body's cues when you're trying to decide about food, right? And making the food choices that you're
I
making.
bought some cheese. So get the cheese out. Where's the knife? It doesn't matter. Just chew off it. Where are the grapes? Or where's the bread? Make myself a nice little cheese sandwich.
Oh my gosh. Yeah.
But I think we go through drive-thrus. What do we do when we go through a drive-thru?
Yeah, I think it's...
Don't go through a drive-thru when you're hungry, but the only time you go through a drive-thru is when you're hungry. How do we cope with all this?
You know, I think drive-thrus are just horrible inventions. It's gotten our connection to food. It's displaced it, right?
Definitely displaced it.
Right?
It's displaced it from their kitchen onto the person's body.
Right. And, you know, this...
You know what I mean?
Absolutely. And, you know, we used to have this very meaningful connection with food, especially our ancestors. We'd
Europe,
sit
we still
down.
do.
We try our best to maintain
Europe
that
and England,
connection.
we still do.
Yeah.
We don't have as many drive-thrus. I'm probably different now. I mean, I haven't lived there for a long time, but we definitely were not drive-thrus. We were not.
It's so
and we
good.
would have a cooked dinner or a cooked. Actually, lunch was our main.
Right.
We'd have a cooked lunch and then a light supper at 5, 6 o'clock, and you know, off to bed at 8 o'clock. My mum had 5 children. I'm one of them. 8 o'clock in bed, all of us. And you know why? Because they wanted to have some time to themselves. Perfect.
That is
We
perfect.
didn't have this problem of eating. So is that the problem going around right now, an eating disorder?
Yeah, absolutely. Even more than COVID, you know, I think, like you said, in America, we've made everything quick. We've made everything fast. No one takes the time out. And, you know, even in England, but also European countries, I have an Indian background. We used to take a lot more time. And I feel like with a lot of things in the Western diet and the way that we're treating, you know, especially our connection with food, I think it's affecting us.
I think so too. But I have to also mention one thing. It's people destroying people.
Wow. Yeah.
Well, a drive-through, you have to have people there to serve you to buy the food. And if you didn't have the building and you didn't have the food there and you didn't have the people and you couldn't go through the drive-through, guess what? You wouldn't be going through a drive-through.
Yeah.
So it's people destroying people.
You're absolutely right, and that's why I think we need a
So,
culture.
what do we do with our soul? Actually, COVID is trying to sort it out.
Oh, that was grim.
Very grim. When I think about it, it's like, wow, what happened?
Yeah.
But we are destroying ourselves, and I think if we kind of go back a little bit to the basics, would you say that that would be?
I think that would be beneficial. I think that would help with a lot
How
of
do we
things.
do that?
So we have something called the 6-pillar approach in our practice.
You would have an answer.
So what we focus on is nutrition, we focus on physical movement, we focus on herbs, botanicals. Now, of course, I'm a Western medicine doctor, so we also do Western medicine evaluation. We also do mind-body practice and lasting complementary medicine. So I really do think a combination of all is going to be helpful.
So this is why you have made your practice with all these. It's 5 people, right? 5 of you that sort out a different part of your body.
Yes.
That's what it is. You don't realize you've got all these different sort of parts of your body that's destroying it.
Yeah.
And so now you've got to get hold of it. And then if you get hold of it, right?
That's how you're going to fix it.
Absolutely. So we're going to end this, Doctor, for a little bit because you're not really going anywhere. But we're going to. I think are we cutting? Are you bringing them all in? So you're going to come a little closer to me. Talking about. We're talking about a human being. What are we? Why are we? And how are we? How do we conduct this thing that we have been given? We've been given this from our first breath. We all have the same experience. We all have the first breath. Remember that. The entire world has a number 1 breath. When you come out, you start to breathe. And then we go through this elongated life that can be good, bad, right, or wrong. We take our last breath. And what is the memory that we have? Or what are we thinking? None of us know. I don't know. I haven't reached there yet, so I don't know what mine is. But what do people think? Or what do they think when they know that ending and they're going to take their last breath? We all have a first and a last breath. How cool is that? Because what we do in between is up to you 3. What you 3 are trying to help. And what they're trying to do is all natural.
Yeah, absolutely. We're
And
trying to.
This is the leader. So.
No, thank you. I was just going to say that's what we're trying to do. Between the first breath and the last breath, we're trying to make that, make that count.
Make that gap.
Make that count.
This sort of, you learn, hopefully. And you only learn what you want to learn. Nobody's telling you what to learn or not what to learn. But you're given everything to learn. And it's a matter of how much you pick up.
Right.
If you pick up some things, some kids at the top of the class and some students are back here. Doesn't mean to say the ones back here don't know anything, they know something different. And it doesn't mean to say the ones up front know what they know in the back. They might be the millionaire back here.
Mm-hmm. It's true.
Right?
Right. Yeah. Right. So it's all about finding that balance, being open to new experiences, knowing how to handle stress and anxiety, finding that peace of mind.
Is the stress and anxiety, which we seem to preach on an awful lot, is that the main thing that seems to drag us down?
Absolutely. I think chronic inflammation is a thing that's causing most chronic health conditions. And one of the reasons why
make you mentally or physically unhealthy.
Absolutely. And one of the things it's causing is stress, anxiety that brings up your inflammation in the body.
So does that, this is what it's telling me, all my doctors, it's telling me that when you go into stress and you're going to this Panicsville place, I call it Panicsville, you are weakening your body, and when you weaken your body, you can act to get things and destroy your body and make you mentally, physically incapable of really handling a situation.
And it goes both ways, right? Our mind and our body are connected. So the way we're thinking about things can really affect how our body is functioning.
Well, that's it. And that can destroy your body or make it good.
Exactly.
Because either way, it can make it good. I mean, you all look pretty healthy.
We better, right? We're doing this integrative medicine.
They all look. You're not fat. You're certainly not carrying overweight. You're very fit and you look very happy.
Yes.
I'm not going to ask how old you are, but I know
Nature, hiking, breathing, movement in the body.
breathing is a very good idea, actually.
Yes, that
But
helps.
breathing normally.
Mm-hmm.
So, what is the difference between stress for females and males? Is there a difference?
Yeah, absolutely. I think there are gender-specific differences. Of course,
Yeah.
hormone is one big thing. There's
Correct.
types of hormones working
Women
in.
want to be like men now, and it's not going to work. It's not going to happen because we think differently anyway.
But yeah, I
How
think
different are we?
I think we're different but same. I don't know if that makes sense, but
It does make sense. We're human beings still achieving stuff, aren't we? We're all both trying to achieve something. But a man will walk out of the front door. Well, this is in the olden days. We're going back a little bit. A man would walk out of the front door, and his wife's at home with a couple of children. He thinks he's got to pay the rent, pay the car payment, send the kids to school, buy the clothes, and get all this together. Isn't that how a man used to think? I mean, I don't know if he thinks that now, but isn't that mainly the man's position? Is that what women used to think?
It's not been my experience.
I'm
That's
like,
for
I
sure.
feel like I do all that. So
See, this
No.
is there's a reason I asked this question. And the reason is because this is how it used to be.
yeah.
And it's not like that anymore. And so I was, because I knew that's what it would be. Because women have become, and that's why I was saying that men and women are the same. No, they're not. And so it's different. So now they're independent.
Yeah.
So as a man, how do you feel?
I think it's great. I think it's
Because they don't have
phenomenal.
to, they don't have to walk out of the front door thinking, I've got to pay for this, I've got to pay for that.
Yeah.
Now both pay for it, or the woman pays for it.
I think it's shared responsibility.
That's
right?
it.
And it
Yeah.
never used to be. Never used to be. But it is now.
Right.
Do you like what? Did you do it because you had to do it to be independent as a woman, or did you do it out of choice?
I have tried to, again, it's all about that balance between the male and the female and how you can bring into the situation. And when there's that balance, there's illness.
So when you do it together, there's definitely a balance because you're both helping each other. Just had another guest and he said that what he's doing without his wife helping him, he couldn't do it. So there's a balance.
It's balance.
It's the yin and the yang.
It's balance.
Yeah, the yin and the yang. Oh, yin and yang are back again. Let's bring yin and yang back again. So anybody out there, anybody who's having a problem with their marriage, what would you like to say?
I think you should come see us because there's a lot of there's a lot of stress. There's toxins in the environment. There's hidden infections. There are mental health issues, and we'll help you at least with that. Because once you find balance within your own body, you can help your
These
relationship.
two people got married. They met each other, liked each other, started dating, big romance. Then they got married, fabulous, and then they're both working or whatever. And then they want children, so now they have children. Now we seem to have, when children come into it, seems to be a lot of complications, but that's not always.
Sure.
So how do we keep them married? How do we keep that beautiful romance and that beautiful love that they had together and had children together? How do we keep that together? Oh, how's she having
Yeah.
Communication,
Communication,
thinking, taking time before you react. That helps.
because you can't take those words back, can you?
And also new experiences together.
Together.
That keeps it fresh, right?
Okay.
You gotta have new experiences.
So go and make love in the garden.
Yes, absolutely.
What can I say? Just make it different. Make it different, but try to stay together. There's too many marriages broken up and too many single women trying to take a job, look after especially with COVID. Now they've got those kids at home and they can't work and they can't support them. Big deal. What would you like to say to the married couples out there, how they can stay together?
I would say keep your commitments, have integrity, be true to your word. If you decided to jump into this endeavor of marriage, then give it your best.
And then you've got your children.
Don't leave when you think the grass is greener on the other side because
Because
it's
it never
probably
is.
not.
No,
Right,
never
yeah.
is. As of a man, what would you say?
I think I'm just going to echo a lot of things that have been said. I think communication is important, and that's probably one of the best things you could do.
Don't go into communication when you're angry. Go take a little 5-minute walk, go in the other room for 5 minutes, then come back, and then sit and talk like two adults, not like two little playing. I want this toy, I want that toy. Don't do that. Just trying to, what do you think? To keep them together.
But what
Communication.
Shiven said too, you know, keep yourself healthy. If you're healthy and you're happy, then your relationship is going to be good
That's
too.
true. Your relationship with yourself, when you love yourself and take time for yourself, you can be a better version for your partner. That
And
is
don't
very
forget, just
important.
because you're in the house, you don't have to wear pajamas 24 hours a day.
I'm like,
Right.
well, or nothing. If it's a
Well,
marriage,
nothing,
I mean,
yeah, nothing could be. Yeah, but even that gets boring. Everything gets boring.
No.
But try to keep yourself up as a woman. You know, put that little bit of extra, little eyelash, little something on, little do something. And men as well, go and take a shower and do the things. But try to keep that relationship fresh and beautiful. Now, how can they reach you?
So you can go to our website. It's www.drshiven.com. The doctor is spelled out, so DOCTOR. And my name is Shiven, SHIVEN.
Wonderful. They've all been amazing. My 3 doctors. I will never have to worry ever again in my life, because if I have a problem, I will call Dr. Shiven and his group on team or whatever. Thank you for watching Vegas Live with Ninon. It's been very interesting. It's been fascinating. I probably said some things that maybe I shouldn't have said, but that's just how I am. That's me. You know me out there by now. You don't know me out there by now. I'm a little bit outspoken. I do speak what's in the mind. I don't mince words or anything. Never have, never will. Probably that's why I'm so healthy. Touch wood. There's a wood here. I have not had COVID, but I am. I've had the vaccine, so that's fine. Don't forget to join. The new word. Join YouTube and Vegas Live with Ninon and become a member. And I will be right back with my next guest. Take care, everybody out there, and don't forget, don't argue. Laugh and smile and have fun. I'll be right back.